We are taking you to the front lines of a national epidemic. The country is in the midst of one of the worst flu seasons in recent memory, with 47 states reporting widespread cases. Both New York and Boston have been forced into states of emergency as hospitals struggle to manage the sheer number of patients. And ABC's Lindsay Davis spent 48 hours embedding with the doctors and patients fighting the epidemic in Boston's emergency rooms.
Yeah. She had fevers as well?
On and off, yeah. Not any higher than 102.
Cassie looks how many in Boston feel. This 2-year-old is spending her Friday in the emergency room at Boston Children's Hospital.
You think it's a toddler, she has a cold, she'll kick it soon, they always have colds, but all of a sudden it just has gotten really bad.
Dr. Ann Stack recognizes the symptoms.
I do think it's probably influenza because of her high fever, her cough.
Cassie's mom, Megan, is especially concerned because Cassie was born prematurely, putting her in the highest risk category for serious complications, and because she lives in a city under siege, where the mayor has declared a public health emergency in the midst of this very contagious and fast-moving flu.
This flu seems to just have spread really rapidly through large numbers of people. There are just so many more people with it.
Doctor's orders. So Nightline spent the next 48 hours documenting this city in crisis, witnessing firsthand the human toll of this unfolding outbreak. Children.
I've been throwing up and stuff.
Parents.
He's not better. He's just not better.
And health workers all on the front lines of the flu.
Were you having fevers 2 weeks ago?
Yeah.
We met those who've already caught it.
This is the flu. That's what you've got.
Oh my God.
Getting that flu shot.
And those trying to avoid it.
How was that?
Nationwide, the flu has sickened thousands and killed at least 20 children.
There we go. Okay, beautiful.
So doctors don't waste any time treating Cassie. They admit her immediately. And as Cassie and her mom are about to find out, they have company, lots of it.
Hi, sweet pea.
Kids with sniffles, fevers, and coughs in every room.
We are at full capacity. The hospital is essentially completely full.
All of Boston's world-famous hospitals are operating in overdrive. More than 750 confirmed flu cases so far this season, more than a 10-fold increase from this time last year. How crazy is it right now?
This is my 20th winter. I don't remember seeing anything like this here in those 20 years.
At Mass General, Boston's biggest hospital in the center of the city, there were 72 confirmed cases of the flu last week alone. Shane Wells fears his chills, sweats, and incessant cough mean he is another one of Boston's latest statistics.
What made you decide to come to the hospital today?
Trying to get back to work because don't have work, you can't pay the bills.
Shane has a temperature of 104 degrees. He's already been out of work for 4 days.
It's costing me financially and enough time and maybe my job.
Shane gets tested for the flu.
7, 8, 9, 10.
And the results are back in just 10 minutes.
And we have a very faint red line above the blue line, which indicates that the person has flu.
It's positive, but there's not much doctors can do for him. He's now past the 48-hour window when medication could have treated the virus effectively.
You ought to be wearing the mask when you're in public. Try to keep yourself away from people, washing your hands all the time.
Shane is sent home. Meanwhile, 4 miles away, back at Children's Hospital, Cassie now needs chest x-rays, her lungs full of mucus.
Just want her to get better.
Because she's dehydrated and has low blood oxygen, she'll have to stay in the hospital overnight. It's going to be a long night for her mom.
Hi, Kason. Hi, sweet pea.
Just down the hall from Cassie is 4-month-old Kason Page, born with congenital heart disease. For children like Kason, the flu can be a matter of life and death.
The main thing that worries me is just like how many deaths have happened from it. I don't want him to be like number 19 or whatever.
He was just discharged from the hospital yesterday, but after repeat vomiting, his parents bring him right back to the ER, an exhausting and scary process.
He gets really sick off of just a simple cold or something like that, and then I don't even want to know what the flu would do to him.
Meanwhile, just around the corner at Brigham and Women's Hospital,
When you're just sitting here right now talking to us, do you feel out of breath?
it's only 1 in the afternoon, and Dr. Ron Wall's section of the ER has already seen 8 flu patients, more than 4 times what they would typically see at this time of year.
Have you had troubles with your bowels before?
Dr. Walls pays close attention to elderly patients who are also at high risk of complications from the flu. 18 people have already died from the flu in Massachusetts. The best way to protect yourself?
Get a flu shot, it's not too late.
Just 6 miles away at the East Boston Neighborhood Health Center, people seem to be taking that advice to heart.
There has been 4 episodes of children being sick in this school. I don't want them to catch it. I feel like the flu shot with some vitamin C, they'll be great.
They've already given out 20,000 flu shots this season, more than 700 on this day alone.
We don't usually have to do big clinics like this, but when there's a need, and particularly like this year when the flu is so severe, and we really want to vaccinate people, we're happy to do this.
What do you think, little lady? You okay?
The next day, we caught back up with Cassie, still at Children's Hospital, now in intensive care. She's had the mucus drained from her lungs and is slowly starting to improve.
Things are definitely headed in the right direction. Only time will tell in terms of whether we go home Monday, Tuesday. So we'll be happy to have her home, and her brother will too.
But what a difference a day makes for Shane Wells, who felt awful as he was discharged from Mass General less than 24 hours ago.
Feeling a lot better, got my energy back, and I pretty much feel, 80%.
The biggest relief for Shane?
I think I'll be all right to go back to work tomorrow.
And a decline in flu admissions over the weekend suggests things are looking up in this city that's sick and tired of being sick. I'm Lindsay Davis for Nightline in Boston.